Thank you all so much for joining the fourth installment of this webinar, the first since the announcement that the polio vaccine rollout in Gaza would be conducted in 3 separate 3-day pauses. Last Sunday, September 1st, the World Health Organization, along with UNICEF, UNRWA, and local partners in Gaza, began the vaccination campaign in Gaza. And to speak on the current rollout, we're honored to have with us Dr. Asena, the Regional Polio Coordinator at the UNICEF Middle East and North Africa Regional Office in Amman, Jordan. He's also a medical doctor with a Master of Public Health from Addis Ababa University in Ethiopia, and he has more than 30 years of public health experience in Ethiopia with the Ministry of Health and the WHO, in DC with John Snow International, and in Nigeria and Amman, Jordan with UNICEF. To give us a better picture of how things are going for people on the ground, we're honored to hopefully have Rafiq Al-Madhoun and Dr. Mohammed Hamouda joining us from Gaza. Rafiq is Rebuilding Alliance's Gaza Program Manager. He's been managing our Hot Meals program in Gaza, currently serving over 60,000 meals a day in partnership with the World Food Program. Mohammed Hamouda also led one of those kitchens in Rafah before he was relocated. He is a nutritionist, and because of the polio pauses, he was recently able to deliver food to children with PKU. And then to provide us with the larger epidemiological picture, we're honored to have with us Dr. Mubin Rathore. He's the Chief of Pediatric Infectious Diseases and Immunology at the University of Florida College of Medicine in Jacksonville. We will start with Donna, Rebuilding Alliance's founder and executive director. Donna?
Thank you so much. I'm really honored to have this opportunity to bring forward our colleague from UNICEF, and hopefully the communications coming from Gaza will all hold. We're watching that they haven't quite connected yet, but if all goes well, inshallah, it'll work out as planned. We are really grateful to see the incredible work that's underway to bring the polio vaccine to the children in the middle section of Gaza, and wishing that if only it could be if only it could be longer in every which way, longer in each day, longer in extending, so that we could meet the needs of children beyond the polio mandate, because the needs are extensive. You'll be hearing more about that from our colleagues on the call. I want to bring forward that the simplest of things are missing, the simplest of things like soap and a set of vitamins to be able to get better nutrition to everyone. These are all asks that I would hope that you, as the audience, consider yourself constituents and call your representatives, your members of Congress, any elected representatives that you have, urge them to raise the issue about how to bring the supplies in that children need, that families need. It's important, and this is the time to do it. The Carter Center had told us that they've had good experience with medical pauses. A medical truce can last to a ceasefire. And so we ask everyone here to build upon this and do our best to extend, because there is breathing room. You'll be hearing that the breathing room matters a lot, that these 8 hours of pause do make a big difference. It's something we've been hearing about throughout the week. This is what we'd like to see extended even beyond. So with that, I'm really honored to be able to welcome Dr. Asena Senga to address us from UNICEF. Please, Dr. Asena, go ahead.
Thank you so much, Dana. Good morning, good afternoon, good evening, everyone. I think I was already introduced, therefore I don't need to say anymore myself, but I'm really happy to be here to give you an update. based on UNICEF's information we have inside Gaza. I myself was in Gaza. Of course, I have also personal experience, not only the information. Therefore, I have few slides to be shared. Should I share the slides myself? I think I can do that. Yeah. Yeah.
Yes.
Okay. Okay. Sorry. Can you see my slides or not yet?
Yes.
we
Okay. Let me go to the first slide then. Give me a second. Yeah, thank you so much again. Therefore, I will walk you through a few slides on the current polio eradication situation globally and in the region, and then detail on the Gaza and mainly on the outbreak response, as Dana said, which started 5 days before and is still going on the second phase. This slide, I hope you are aware that currently concerning polio, we have wild polio virus only in Pakistan and Afghanistan. These are the two countries remained as with wild polio virus. But other countries, as you see here in Africa, the green is what you call it, the circulating vaccine-derived type 2 virus, which affected more than 30 countries, up to they reached, I think, up to 36 countries. It is not only in Africa, Middle East and North Africa is also affected. You see it here in Algeria, you see it in Egypt, in Gaza now, in Yemen a lot, in Sudan, and so on. Therefore, and the one in orange is the type 1 circulating vaccine-derived. Therefore, all these countries are countries with lower routine immunization. Therefore, the circulating vaccine-derived happened mainly after the switch in 2016, and these are the countries with low routine immunization. Some countries may have higher routine immunization at national level, but their immunization coverage at sub-national level is lower. Algeria is, that is the reason in Algeria and in some parts of Egypt. Therefore, all these countries are because of low immunization coverage and low immunity of children, that children are being affected with this vaccine-derived poliovirus. Therefore, it is clear once the routine immunization is better, even though there is importation of this circulating vaccine-derived, countries were able to stop the transmission fast. Therefore, routine immunization is a key for polio eradication, for polio stopping polio transmission. The next slide is on the polio outbreak in the Middle East and North African region. As I said in the previous slide, Algeria, Sudan, Egypt, and Gaza, Palestine, and Yemen are now the countries with circulating vaccine-derived polioviruses. The active outbreaks are in Gaza, Sudan, and North Yemen. Egypt and Algeria have stopped now the transmission, but they have not been declared that polio-free. But I think what should be clear is all countries are at risk. As long as there is a virus in the region, there is a virus globally, all countries are at risk. The Algeria virus was imported from Nigeria. The Egypt had repeated importations because of population movement from Nigeria, Yemen, and Sudan. And the Gaza virus also came from Egypt. Therefore, globally, polio is really being transmitted from one to the other. Our political borders are simply political borders, but for the virus, there is no border. Therefore, some countries are facing repeated polio outbreak. And therefore, the solution is we have to eradicate it from the whole world. Otherwise, no country is free. I hope you are aware that New York, London, and so on have also reported last year some cases. The next slide now, I'm going to Gaza deep. On the right side of this slide, you see the Gaza map, and you see where the viruses were detected. On 23rd of October, 7 samples, environmental sewage samples, were collected from the 2 sites, Khan Younis and Deir al-Balah. These samples were sent to a lab. By the way, global polio eradication has accredited labs, lab networks globally, and one of those labs is in Israel, and that lab tested those samples, and 6 of the 7 were positive, and that was announced on the 16th of July. And then the samples, as based on the guideline of the polio eradication, all those samples have to be sent to CDC Atlanta for sequencing. They should be sequenced, and it is through the sequencing that the linkages are made. Therefore, this virus was linked to the Egypt case, of course, and the Egypt case from September 2023. That means most probably this virus entered Gaza before the conflict on October 7, but you can't rule out, we can't say 100%. But after that, a 10-month-old child became also positive for circulating vaccine driver. Therefore, the Gaza outbreak now is both environmentally positive and also a child has been also affected. But for your information, the surveillance has been really totally almost stopped since October 7, before this June collection. Therefore, there was no surveillance at all. That is why maybe the virus was detected very late. That means linked to the September 1, but detected in June 2024. Therefore, the surveillance, there has not been any surveillance in Gaza after the conflict, but now the surveillance is being strengthened. Therefore, what is the risk? What does it mean? What does it mean there is a virus? As I told you in the previous and my first slide, countries are being affected even from a very far distance. 2 years ago, Malawi, which is in southeastern Africa, detected a case which was linked to Karachi, Pakistan. Therefore, viruses move where people move, and population movement is very high. Therefore, this Gaza case can move to any of neighboring countries, to Jordan, to Israel, to West Bank, to any of the countries around are at risk from this virus where a population moves. Therefore, it should be clear that this is a risk for the region, not only for Gaza children. That is why we should take immediate action and stop this transmission. Then what did we do? Once announced, based on the global polio eradication guideline, we went there. I was one of those, the WHO colleague deployed to Gaza. The first thing is Gaza Ministry of Health have not conducted any such campaign for many years. Therefore, we have to sensitize them. What does it mean? We have to conduct a risk assessment, which areas are affected, and we have to develop then a response plan. A response plan is not only a polio campaign, but strengthening the surveillance system, strengthening routine immunization, building the cold chain and system, and so on. Therefore, we started doing that, and then we developed also a detailed micro planning, including mapping of the population, mapping of the resources where they are, mapping of the health facilities, and so on and so on. All this has been done. And at the same time, we started projecting how many cold chain equipment we need and what should be the target population and so on. And we immediately ordered also cold chain equipment because in Gaza, most of the health facilities have been demolished really. And there are no health facilities. They don't have many refrigerators nowadays. They don't have any cold room. UNICEF has to rent from a private one cold room. That is the only cold room now being used for vaccine. Therefore, but now, at least for now, we procured additional cold chain equipment to not only for the campaign, but also for routine immunization. And then we also deployed additional technical support to support the ministry officials in Gaza. This is the map of Gaza. On the left side is the map before the war. On the right side is after the war. You can see where the population and the health facilities were. The main focus area is the health facilities, but you can see also the population. Most of the population were in Gaza city and to the north side. Also sparsely populated Deir al-Balah and also Khan Yunus and Rafah. Therefore, this was before the conflict, before the war. But now there are no many people in Gaza city as it was before, and also in North Gaza. Most of the population is now in Dar al-Balah and Khan Yunus, and close to the sea, far from the east to the west side. Therefore, when you see the concentration there, how people live, you will be really surprised. They are under really very difficult situation. I'm sorry to say that. This dark, I don't know, spots you see, I don't know if you can see my cursor, these are nearly evacuated places because evacuations are happening. As you can see, there is no that much population in Gaza. There are some, I was told, but there are not many people. Therefore, the population are around here. Therefore, the plan was developed based on this. That means,
Dr. Asma, could you
yes,
something with your screen where it's splitting and showing the next slide coming? Can you just focus on the main slide? It'll be easier to see. I meant to ask you sooner, but
now you can. Oh, you can't see the main one. You see the splitted one.
We see both the main one and the next one, so we're seeing two slides in front of us.
I see. I don't know. Okay. I don't. Sorry.
That's what you're seeing on your screen, probably, that you have both.
In my screen, I see both. That is the reason, you see.
Yeah, and if there's any way to make your screen just look at one, then we'll see just one at a time.
Wow, sorry.
But if not, we can manage. We're seeing it at the next one.
No. I think I should go back.
It must be a sort of setting, perhaps. There we go. And if you go to the show, the view, it should show you.
Now the
same thing. Oh well, please go ahead. I don't mean to interrupt you.
No. I think there must be a solution because the problem is I have two screens. You say they have to, because I use Teams most of the time. Therefore, should I go where? Guide me, no problem. Or Nathan, or you can project it from your side also, because I want people to see the whole picture properly. Therefore, what should I do? Guide me.
Nasreen, do you have the slideshow on your computer?
I made it slideshow. That is what is happening.
It's the split screens problem that's coming up that makes it so we see both of them. And it is working well, so I think maybe we continue as is, unless, Nasreen, if you have the slides, then you could show it from your computer.
Share the slides.
The slide. Let me see.
Sorry.
It's all right. Let me
just.
I think the same now. Now it's perfect. Got it. You solved it.
Perfect now. Thank you so much. I switched it from one to the other. Okay, thank you. I'm sorry if I need to repeat some of the slides. Is it okay?
Should we continue? Clear, and just the more detailed ones became more hard to see. So I think you're fine. Keep going.
Thank you so much.
Thank you so much.
Therefore, the slide on the right side, as I said, is the current slide where the population is, and this is how the planning was prepared. Of course, we have a plan also to reach the Gaza city, the north, and also to Rafah side, but the majority of the population are now in Khan Yunus and Deir al-Balah. Okay. This slide shows the detailed plan, what we prepared. according to the GPI guideline, we have 2 rounds of vaccination campaign are recommended to be conducted within 28 days. Of course, it didn't happen because of Gaza peculiar situation. The first round was started on September 1st, and the second tentatively will be around the 15th of October. 640,000 children under the age of 10 years of age in all governorates. Gaza has 5 governorates. And the campaign modality in many other countries, we do house to house, okay? But in this case, it is fixed site and mobile teams will go around. It will be for 3 days plus 1 day. This plan has gone through a lot of changes, of course. And the micro plan was developed. It was flexible and being adapted regularly depending on all the situations, security and other situations. Therefore, 1.6 million doses of novel oral polio vaccine 2 has been released because the type of virus identified was type 2. Therefore, the vaccine recommended by GPI currently is novel oral polio vaccine 2 was released from the supply, and more than 650 sets of refrigerators, freezers, cold boxes, and vaccine carriers were procured and transported. And social and behavioral change and awareness activities happened in Gaza with external input, but mainly also using the local people, using the local information, and coordination, which was very critical with all actors on the ground for critical operations. Or everybody is really coordinating. You are using also the health cluster in Gaza to coordinate on this one, and all other UN and all humanitarians are really participating and supporting, and this really should be appreciated. Therefore, this is the main plan. I will go to some of the details in the coming slides. This was the refrigerators at Karam Shalom when they arrived before transport to Gaza. The refrigerators, the cold boxes, and the vaccines, 20 refrigerators, 100 cold boxes, 500 vaccine carriers, 1.6 million doses of vaccines were supplied for these 2 rounds of polio campaign to vaccinate children under the age of 10. Therefore, the micro plan, when it comes to human resource, because the micro plan has to have everything, vaccine needed, cold chain needed, people to be vaccinated, human resources, different levels. Therefore, 2,700 people, health workers, volunteers, drivers, monitors will be involved, and they are being involved now. At that time, the plan was to do everywhere at the same time. Therefore, now, for example, those in the north, they are waiting there. They are not being involved. Therefore, the number of people being involved now may be a little bit lower than this, but all of them will be involved at the end. And vehicles, 130 trucks, buses, and so on are planned. And fuel is necessary, and these have been really secured. And operational cost, UNICEF and WHO released operational cost based on the Ministry of Health plan. Ministry of Health, with support from WHO and UNICEF, developed an operational plan and a budget to do every activity, including the search support, and about $2.5 million have been released as operational cost support the 2 rounds of activities. And the vaccine is the target population is 140,500, and the vaccine released for the first round will be 800,000, and the total will be it is only in Gaza already 1.6 million doses. Therefore, this is the detail, the micro plan to reach these areas. The scope is all the Gaza, and the modality is, as I said before, fixed post and mobile teams, very flexible. At the beginning, it was planned to be 5 days, but now it is 3 days. When necessary, additional days to be included. Robust micro planning prepared and emergency operation center was established at the WHO office in Deir al-Balah. All these arrangements are being done, and people are working 24 hours. I can't tell you. They are working day and night for this to happen. This is the cold chain plan. There is a central cold store at Deir al-Balah. There are 11 health facilities identified in everywhere in strategic geographic areas. And then vaccination posts are available. Deir al-Balah cold store. So there is a cold room with a capacity and also a freezer room. The freezer room is for ice packs freezing. And 11 cold chain capacities, as I said above, and then vaccine accountability monitors have been deployed. Therefore, how the vaccine is transported is the vaccine and cold chain comes through Karam Shalom, transport to Deir al-Balah, and then from there to be distributed everywhere. It happened already to the central. It happened since this morning to the Khan Yunus and some of Deir al-Balah and Rafah area. And after 3 days, it will be also transported to the north. This is a detailed requirement, what is required for this campaign, vaccine and other logistics requirement. And you can see we start with target population, the vaccines needed, the number of vaccine carriers. All these details have been done, and all these are available now. The number of vehicles, the fuel needed, the fridges, and also the ice packs. All these have been planned, and per governorates. The middle one is the one which was sent called middle, which was completed yesterday, but part of this is also the central wing with Khan Yunus and Rafah. Therefore, majority of the population is in Khan Yunus and part of Deir al-Balah here. Therefore, this is now being covered. I will show you some figures also on the second round, the second phase, which started today. This was really the final plan, which was agreed with the authorities also. Therefore, middle zone, south, and north zone. It was divided into three. Therefore, the middle was started on the 4th and it was completed yesterday. There are some additional activities, for example, post-campaign monitoring and some health facility transit points also to continue. This happened already. I will show you the result in the next slides. The next is phase 2 is the south. Therefore, started today, it will continue to the 8th, 3+1. We hope, depending on the performance. And as Dana said at the beginning, the teams are working 8 hours per day. It doesn't mean they stop there, the vaccination stops there, but the team continues working till 11 and so on, compiling and preparing for tomorrow. And the north, the team then will move to the north from 9 to 12. Therefore, the campaign will end around 12, 13, around, therefore, till mid-September. Therefore, this is the main plan. Therefore, final guidance was given from higher level was first round campaign to be tentatively from 1st to 11. It can go to 12 or 13. And as it was said, the operation time is 8 hours from 6 to 2 p.m. And the humanitarian post is 3+1 days. And campaign activities will be conducted in coordination with coordination and liaison administration. And authorities allowed also supply movement from north to south, south to north. This has not been easy before, but for this activity, it was allowed. And it is also confirmed the second round to be 4 weeks after the first round. And it was also agreed that there will not be any evacuation because there are frequent evacuations in Gaza, as you know, from some blocks and so on. But during this activity in these areas, there will not be any evacuation. Therefore, and this there has not been any, by the way, since we started in the implementation areas, and this was really good. Now I will show you some pictures. This was the training of vaccinators and supervisors in Dar al Balah. A very high attendance. All these are really high-level professionals. They are really very committed to make sure that this happens. We are really grateful for all these people to come and to attend. And the same training activities, because they have to be oriented on how to do. They have not done it for a long time. This is the preparation. This is the bus. Inside the bus, they are traveling with their vaccine carriers to the vaccination site. All these people are really very eager and very happy to do it. On the right upper corner, you see the vaccines, 5 vials given for each team. Each vial, by the way, has 50 doses given to the vaccination team. And on the lower is 2 kids being vaccinated and being also finger marked on the right lower corner. And the first 2 days, 1 and 2, they reached really 158,000 children, close to 159,000 children. This is above the target. The target for that area, tentatively. By the way, population figures are not easy in Gaza because people have been moving and so on. It is not easy to do any, therefore, but from the estimation, even during the first days, they achieved high number of children. And this slide is to show you the 4 days, the completion of phase 1. 189,591 children have been vaccinated. And day 1 was the maximum. They vaccinated 84,000. And day 2, 74,000. And then day 3, 28,000. And day 4 was only few children were vaccinated in comparison to the other days. The others are under 5, above 5, and male to female on the left side. Therefore, really the turnout was extremely very, very, very high. You don't see it in polio campaign nowadays in other countries. It is really, that is why people go house to house. This was really fantastic, and people have a high demand for vaccination, and they are.
Thank you, and I hope that connection will be restored shortly. It's a remarkable thing to get the details that we are hearing. And as our guest, Dr. Asna is actually disconnected. Nasreen, what are you seeing on your side about?
He's on. It just seems like his screen is frozen.
Just frozen. So hopefully Dr. Asna will be back with us shortly, and we'll be able to answer some of the questions that are coming up. And it looks like he'll come back in. So thank you, Dr. Mubin, for joining us. You come at exactly the moment when one camera froze, and we were really glad to have you.
I apologize. I was on another meeting or just ended.
Yeah, what challenges in general? Then I'll explain more about that. Dr. Asa, go ahead.
Can you hear me now?
We're back in. Yes, and you can continue.
Sorry.
Dr. Mubin is also with us, so he'll be able to see the rest of your presentation as well.
Okay, you can see my slide now?
Not yet. Go ahead and share screen.
Okay, I will do. Sorry. Sometimes it happens like this. Okay. I will do.
And you're joining us from Amman, right? That's where you are right now?
Me?
Yeah, where are you?
No, I'm in Amman. Yes, I'm in Amman. Yes.
Good.
Can you see now my slide?
Yes, and you'll just want to, focus on the slide. Yes, great, perfect.
Okay, I think which one is better? Okay, you can see now full. Am I right?
Yes, and well, it switched, so you'll want to hit that button to get it to full with one slide. Right now, you have both. Yes.
Okay, I will do. Okay.
Yes, perfect.
Now it's good. Okay, thank you so much. Therefore, I'm almost
It
finishing.
switches somehow when you start talking, it switched to both. So you had that display settings button at the top left.
I will do. Okay. What about now? Now
Yeah.
it is full.
Yes.
Yeah, thank you. Thank you. Sorry. Therefore, we have some challenges. I mean, it is obvious that in such situation without challenges, lack of prior experience in doing such a campaign is one of the challenges. Why? One of the reasons for delay. It is not the only reason, but one of the reasons for delay was that one. They have not done such a campaign before. Therefore, we have to do a lot of discussions, orientations, and so on. The other reason is lack of infrastructure, mainly cold chain equipment. It is not because they didn't have before, but it has been really destroyed. I'm sorry to say that. Destroyed in many places. And most of the refrigerators, the cold boxes were in the north, but the population now is in the south. That is really, and limited movement of the campaign implementers. It is not easy. We have to get permission to travel from one to the other for all of us. And continuous population movement due to evacuations is also a challenge for planning. These are not the only challenges, but these are the main one. This is because of the security challenges that many of the challenges are. Therefore, for polio, what are the next steps? What are you going to do? We have started already the second phase, and the third phase also will continue after the second phase. The second phase is south, as I said. The third phase will be north. And there will be an evaluation of the first round and planning based on that evaluation. Planning of the second round will be done. And there will be a discussion, and we have started it already, possibility of adding other services. For example, some nutrition supplies, micronutrients, some hygiene kits, and so on and so on. We have been really pushing on this one, but for different reasons, that didn't happen. But this is an opportunity really to deliver other services also. And the second round will be conducted. For immunity to continue, the routine immunization should be strengthened. I think that is really, I want to stress. Everyone has to really work on this to happen. If routine immunization is strong, the polio transmission is not going to continue. That is what's shown. In countries where the routine immunization high, the polio will remain as index case, the first case. But when there is routine immunization is low, the transmission will continue. Of course, surveillance should be strengthened. How do you know if there is no surveillance that there is a virus? That is also very critical. This is phase 2, by the way. Canyon is today. You will be surprised to see all this population line waiting for all this at the vaccination sites, as 3 different vaccination sites. This is really fantastic. How people are really eagerly waiting for this. And with this, I think they can stop the polio transmission easily. For routine immunization, only 2 slides from the second quarter report. UNICEF supported Gaza actually with this vaccine since December 2023. About 1.5 million doses of vaccine, different vaccines have been supplied for routine immunization to continue. For this, UNICEF is working with UNRWA and with WHO and UNICEF in country offices, and these vaccines has reached, and cold chain equipments have been also supplied in addition to the polio. Before that also, and the UNICEF also rented the cold store, the central cold store, and supplied all the necessary materials. The performance of the routine immunization based on the Ministry of Health UNRWA data for different antigens, IPV1, IPV2, BOPV, MMR12, Penta1, Penta3, PCV3, and Rota is really very high, 90%, 89 to 90%. This is based on the Ministry of Health quarterly target population. And on the right side is the number of children vaccinated with routine immunization. On the left side is the percentage. I think Gaza had history of high immunization coverage, 99% for many years. This is really fantastic. Therefore, I hope that, of course, I visited some of these facilities when I was there. Still, there are some challenges. People have lost their records and so on. They are revaccinating them. But I think really they are really doing a good job in maintaining routine immunization. This is the end of my presentation, but I'm available really for any question. Sorry for some inconvenience, my disconnection and some slides. Over to you.
Thank you so much, and thank you for that thorough description of everything. We have one question about, in a way, I want to preface the question. It's a question about, because the polio pause is only 8 or 9 hours a day, and it's already ended, by the way, for today. The pause is over. It might be one of the reasons why it's so difficult for us to get our other guests to join on the line with us. Oh, we do have Dr. Hamouda joining us. The question is about safety. What happens after the pause ends? And also in the areas not under polio pause orders, are hostilities picking up? Do you see bombings happening? And I want to say that one of our guest speakers can't attend, a doctor who's been really thoughtful about the infectious diseases there in Gaza. He can't attend because a bombing took place near where he was. He narrowly was able to come out safely, and he's been responding to the medical needs as a result. So, Teresa, what can you say about what's happening at the edges of the pause?
Thank you, Dana, for this question. It is difficult, really. I don't think I can answer. I have not heard, because I'm not in Gaza now. I have not heard a major event, and I may be wrong, but I have colleagues I daily communicate. I have not heard any major event in those areas where vaccination has been happening. But I can't say, because I'm not there now. And why only 8 hours? I can't answer that question, because we requested, we pushed for more hours. Actually, personally, my suggestion was, the first request for us was to have 14 days, 7 days preparation, 7 days vaccination minimum. That was our request. Okay, that one is not happening. Can we make it 9 days? Not possible. 7 days, not possible. And at the end, we said, can you make it at least from sunrise to sunset, at least the whole day, people to be free? But what is approved and is from 6 to 2. Therefore, why it is not for me to explain. But as a humanitarian organization, we requested really to be more and to have time. But yeah, we have what we have, and we are working with that.
And what a great thing to see people in the street like that. Certainly amazing to have the chance, and what a also tremendous accomplishment on UNICEF, WHO, UNRWA's part to be able to negotiate and bring about this polio pause, the medical truce. I'd like to ask Dr. Mohammed Hamouda to comment. And Dr. Hamouda, please turn on your screen if you can. Let's hope that your internet will hold. You're calling in from Gaza, and I'd like you to tell us the efforts that have been underway. Efforts that have
Hello.
been underway to reach young children who suffer from phenylketonuria, PKU. Go ahead, Dr. Hamouda. If possible, turn on your screen.
I'm Muhammad Hamoud. I'm a specialist in nutritionist. I work with rebuilding aliens as responsible for kitchen, providing hot meal to displaced people in the south in Gaza Strip. And I am leader for the PQ patient supporting team.
Wonderful. What did you experience? Your challenge was to use the pause to get food to the PKU children. So buying the vegetables and fruit, what did it look like at the market? What was it? How did it go in the middle section? Because we're matching the pause. How did it go with finally meeting the parents and really finding the children that have all been scattered due to their relocations? Tell us your experience, Dr. Mohammed.
You asked about the available PKU patient food in Gaza Strip, the challenges to find the available food for him.
First, you had to find the patients. Where did they go? Next, you had to find the food, and then bringing them together with the food. Go ahead and explain how you've approached this. What was it like? What was it like in the street? How did you manage to find the families? And then how are the families?
A difficulty to obtaining a database for PKU patients because we have a difficulty to communicate with the MOH as a result of the war. But we continue trying and then find some database, and then we face very challenges to contact with this patient and this family, because many of these patients and many of this family lose her houses and change her address and lose her telephone number. And the connection and the telephone on Jawal or telephone connection in Gaza Strip is very difficult to make calling with the family patient. We trying to over these challenges. We starting the working and providing support for this family. Before 2 days, we distribute 60 parcel for PKU patient in the center of governorate, and today we distribute today we distribute 40 parcel in Khan Yunis governorate. We work with the vaccination period in each governorate to help us to be in safe zone. The families be very wonderful and very happy when they see this parcel, and after they come back to their house, they call me and ask me to thank all people in the world that give support for him from the first of the war. They face very difficulty to obtain these items of food. Unfortunately, when I doing a questionnaire for this PKU patient, I find many complication obtained as a result of unable to the family to get the food, the special food. Some of these complication in many patients, they become mild delay mental orientation, and some have skin changes and hair changes and urine incontinence, and most of them be very nervous. All of these complication and the symptoms appear as a result of delay to support for this patient. We're trying to continue to support of them, and I managed to visit them in her shelter, and many of them need something rather than special food. They need special diapers because they have skin sensitivity, and the diapers is very cost in Gaza. And many of this family lose their work and lose their economic status and lose their houses. They become homeless, and this is the situation of her her patient had more difficulty for his life. They didn't find anything to eat them. This item is
I should
very good.
mention one clarification or one thing to bring forward that so Rebuilding Alliance had been asked by families with children with this condition. It's a something that is a congenital disease that one of the things that you'd usually test babies for in the pinprick to their heel. Phenylketonuria, for these children, they're unable to digest most proteins, almost all proteins. And to be able to live a normal life, which is entirely possible, they need two things. They need low protein diets, which is where we were able to deliver packages with fresh fruit and vegetables, canned vegetables. That was the first time in all these 8 months, 10 months. And the other thing that they need is a specialized medical food with the replacement amino acid. It's expensive. The being able to get it into Gaza has stopped. There may be some available, but the dates have expired. It's a really huge challenge, but the first step was find them, and the next step was get them some food, and that's appropriate for their diet, and that's what Dr. Hamouda and the Ardal and San Association, our grantee, the largest pediatrics NGO, community-based organization in Gaza, both of us all working together to try to resolve this problem. Through it, we'd hoped through Dr. Mohammed's eyes to give you some indication of what that pause means, at least during the hours of the day when it's happening. It meant it was able to connect with the families and get the food parcels to them. And so I'm really glad to hear that, Dr. Asma, you're saying that the next time when it happens, I'm really glad to hear that there will be the next polio vaccines in mid-October, and that the plan will be to get the additional materials to everyone. Dr. Mohammed, do you have any other comments that you'd like to make? And if not, we'll go to our next speaker.
Please, I don't understand your question.
Oh, just anything else you want to tell us. We have one more speaker after you.
We have now more than 140 PQ patients, and I think in the next week we can reach more than. We will trying to reach for all 140 patients to provide them food parcel. Inshallah, we can prepare other support for them, like cleaning material or like some other items. Inshallah, we can do something for this family because they need really they need support. Thank you.
You'll be glad to hear. I learned that in the north, at our kitchens in the north, they've received they're at least being delivered around them is gluten-free flour, which is also usually low protein. So hopefully we'll be able to see that happen in the south and the middle also. And certainly by bringing it forward to this group, we hope that others will support us as we keep getting those weekly boxes and other things. The diapers will be an important consideration, and the medical food, the Mead Johnson PKU formulas that are needed, much appreciated. We'll do our best to get whatever we can delivered. I'd like to go to, and thank you, Dr. Mohammed, for your efforts, and it was really great to hear that you reached the families.
Inshallah, we can take approval to use the special formula in the north of Gaza, and we can give support for our PQ families in the north of Gaza nearly, inshallah. Thank you, Miss. Thank you, Donna. Thank you.
Inshallah. Thank you very much. Dr. Mobeen, please go ahead. We'd like your thoughts about infectious disease in general, about what you've seen in the United States as where you are, at the University of Florida College of Medicine, and then also, if you would, about your own experience, as a doctor who came from Pakistan, and the little bit of the insight you have based on polio and its effect over there.
Yeah, thank you very much. After hearing these other healthcare providers, it's just amazing what they're doing, and it's like building a plane while it's flying. And to give this polio and other support services while explosions going on all around you, I think it's incredible. And I was thinking when the doctor from UNICEF was, I think it's Dr. Sega was saying that, um, uh, they are all there coming there, and the term that came to mind, you have a captive audience, no pun intended. They are there, and I'm glad they are coming. And we know that they all want vaccines because of the 99% vaccination rate they had before. So these are the committed parents who really worry about their children and going to do whatever it takes to take care of them. I think with regards to polio, I think one of the things I want to Dr. Hamoud and Dr. Hamouda to take it back to all the healthcare providers there and Dr. Sega for his team for doing immunization. You're not only serving the children in Gaza, you're actually serving the children in Israel and Jordan and all the neighboring countries, because if this becomes an outbreak, it'll spread to those countries also. So, and beyond that, you're serving children in the United States and the Western world, because it's only 12-hour flight away to many parts of the world and shorter in other parts to get this disease, terrible disease, which Donna, I've seen these cases. I actually never worked in Pakistan. I did my medical school and came to the United States. But as a medical student, I did see cases of polio. I also have cases of polio in my family. I also have friends who had polio. Um, I have friends who came to United States who got polio in Pakistan, and they're my age, and they suffer from the devastation of polio, and now many are suffering the post-polio syndrome. So this polio is devastating not only to the children, but to the whole families and communities. If they get, especially the paralysis, and this stays, for them for the rest of their lives. And there's now we now know there's something called post-polio syndrome that we are seeing in the elderly. So I think this disease, as I said in one of my other presentations, this polio virus is the most non-racist. All germs are so non-racist. They don't care if you are white, black, brown, yellow, male, female, young, old. All they want is their heaven, and their heaven is somebody who's susceptible, and they can infect that. And they love these viruses, these germs love to spread to other people. That's their job. That's their only thing in their life. So I think these activities are certainly tremendous. Now, we know the challenges that were faced with the immunizations in Pakistan, in Afghanistan, in Nigeria. But compared to what the challenges these workers are facing in Gaza, those were nothing. We know that many polio workers lost their lives because of misinformation and disinformation about polio in many of these parts of these many countries in the world. But this, I think this is like. I mean, I was hearing this these presentations, especially with Dr. Hamouda. I mean, I don't have any words to add to that. I think this is something we all need to support, if nothing for selfish reason. I think it can come to the United States. People don't realize that we need to push our professional organizations. We work about Opachuki virus, the new viruses that we are seeing in the United States, and dengue. But this is what polio can do. It could be devastating. So, Donna, I don't know if there's anything else you want me to address, but I can tell you that if you have ever seen a case of polio, and knowing that it can be prevented, is gut-wrenching, because why we could not prevent this case of paralytic poliomyelitis when it is so easy, literally. I mean, it's so easy. It's like drinking a cup of coffee. That's how easy it is, even easier than that.
I want to ask, once a child gets polio, is there any pathway that eases the symptoms? Does it change over time? What will happen to that child who has polio in Gaza?
Yeah, yeah. I think with paralytic poliomyelitis, I mean, many of you know about the iron lung. If it can affect your muscles, and what I'm going to say next may sound horrible, but it's lucky if you just have a limb paralytic polio. If your respiratory muscles become paralytic, you can't breathe and you will die if you're not on a respirator. And the famous iron lungs. Many people survived, lived in those iron lungs before we had ventilators and trachs for years and decades. I think the last one died a few years ago, I believe. I could be wrong. So I think, yeah, Nara, if you can't, as I said, it sounds horrible, but those who get paralytic poliomyelitis, the lucky ones just have a limb paralytic. Once it gets moved up towards your breathing muscles and you can't breathe anymore, you'll die if you don't have a respirator. So, this is not something that just causes what we most of us see with paralytic poliomyelitis is individuals with paralytic limbs, right? We don't see many of them who got the respiratory muscles paralyzed and died, and many of them die even while they are being treated under the best of circumstances that we have right now. And in Gaza, there is no electricity. There are, I understand, very few, if any, respirators left. I have seen in Pakistan before respirators that families would take turns 24/7 to use the bag, and that can't last too long either. So I think this with the situation going around, if you get paralytic polio myelitis, your outcome is very bleak.
It looks really challenging. I have some our photography team has sent some photos, and I wanted to bring them forward because of the public health situation. If there's to be any chance of overcoming this level of concern, and there's got to be a way to address sewage, the question of being able to get clean water. Gaza's aquifer was contaminated with salt water throughout the entirety of the area. I think there's one spring in the very, very north of Gaza where there's clear, sweet water available that people are cleaning and washing with water that's not potable. But that means that it's still, if there's a polio contamination or any of the other diseases that are there, they'll be experiencing that as well. So the issues are to be able to bring the health back to children and their safety, of course, to bring that not only medical pause and medical truce, but actually ceasefire and ending the war, so that there can begin the recovery. That's all really important on all of this.
Yeah. Donna, it reminds me of a situation, you're absolutely right. We may give these kids vaccines and they may die from a bombing raid, but the other part was there was a study done years ago in Africa about prevention of HIV infection, and the recommendation at that time was that these kids should get bottle fed and not breastfeed because we know breastfeeding transmits HIV infection. The study was stopped because what they found was that kids who were being bottle fed were not getting HIV infected, but were dying more than those who were HIV infected and sooner because of diarrhea and other illnesses. So what is the sad irony of this is that we're going to give these kids polio vaccines. Hopefully they will not get polio. They may die of bombing, or they may die of another diarrheal illness for which there is no prevention because of the sanitation and infrastructure. So that's not to say we should not immunize them. That is to say that this is not, as you said very eloquently, this is not the real answer. This is even not a band-aid. This is something we are trying to do our best under the worst of circumstances.
Exactly. And one of our colleagues had said, like, how can this be that if they can't stop the bombing around them, or if children are dying of of the other diseases. How can polio be the one focal point when there's so much needed? We're hearing about hepatitis A is extremely difficult. The level of skin diseases are outrageously so. So it's certainly the hope is, and our responsibility as in the medical community throughout the world, in the advocacy efforts, in for constituents, for those of us who can reach to our members of Congress, and to our presidents and elected leaders, it's really important that there be a pause that allows for everyone's needs, that families and children come first, that children have to have safety, they have to have cleanliness, they have to be able to get the soap and medicine and vitamins and food that they need. So it's the simplest of asks. It seems like it should be obvious, and keep asking, keep pressing forward. Hopefully, I'm not sure sometimes that the elected officials fully understand the scale and danger of polio and the scale and danger of what the children are experiencing there in Gaza and the effects that could have throughout the region. Thank you very much, Dr. Mabin, for your comments. And thank you very much for Dr. Asna to be able to join us and your thorough description of the planning and the excellent efforts that have gone forward from UNICEF, who was key in negotiation and bringing in the materials, being able to organize and train everyone, the WHO, UNRWA, the many clinics that have been helping, and the private agencies that are assisting with all of the vaccination rollout. Glad to see it's continuing into the southern area, and may you be safe and successful in all of that. I see that there could be a further discussion if anyone else. Yes, Dr. Hamuda is saying stopping the war is really key, and that's certainly something that all of us have been asking for, especially the UN agencies, so consistently. If only the world will listen, and if only our numbers prove to be what's needed. So thank you very much. Dr. Asna, any closing remarks?
No, thank you so much. Really, the question of why only polio is, as I think, as Dr. Mobin said, polio is really a devastating disease. But the question is, can you use really these opportunities to deliver other services also? I think that is a question we should ask. Polio should be responded because it is dangerous, not only for Gaza children, but for all children around. And it should be eliminated and eradicated from the whole world. But I think the discussion from all partners should be, how do you use this opportunity? Because we are reaching all the children almost. I'm not sure if any other program is reaching all the children like this, therefore within a short period of time. Therefore, I think the discussion should be through the different forums, should be, let's use this opportunity to deliver also other essential services, because children are dying, as it was said, from many other causes. And the mothers need a lot of other support to really to keep their children healthy and for themselves healthy. And hygiene is very critical. When you see down there, it is really a very difficult situation. Therefore, let's continue that discussion to the second round to make sure that other services are also provided. And maybe you can organize also another similar campaign activities if our children are not receiving the necessary essential cares also. Otherwise, thank you so much for the opportunity. I hope such discussions will continue and many people have awareness and also support Gaza. And as you said, Dana, advocate also to the high-level decision makers, to the Congress and so on, to have this awareness and support.
I want to
really
say,
and put pressure, yeah.
Thank you. I want to say that next week, instead of doing the webinar, we'll be actually in Congress. You'll be seeing a panel discussion from the Senate floor, It's from a briefing room at the Senate.
Yeah.
We're really proud to have that sponsored. If UNICEF would like to participate as a guest speaker there, we welcome you. We have doctors presenting, and also a former U.S. government official will be joining us as a guest speaker too. We'll be talking a bit about policy. We'll be talking very much about health. We'll also, if all goes well, we'll have a doctor joining us from Gaza to speak to the Senate group as well. I'd like to ask my colleague, if you haven't already, please post the link that we are using so that guests on the line can reach to their members of Congress, those who are Americans, certainly reaching your senators and your representatives. Tell them why this matters to you. And they do intervene, and sometimes on the smallest of things. If nothing else, let's get some soap getting to those children. Let's get the vitamins in, get the food and medicine that they need. And that should be something everyone can support, no matter what their political biases might be. So important that we can make that happen. Thank you very much again, Dr. Asna. Do we still have Dr. Mohammed on the line? Dr. Mohammed, would you like to make a closing remark? And Dr. Hamouda, go ahead. You're on mute, though. We can't hear you. And it might be Dr. Mobeen. Go ahead with your closing remark.
Well, I think I wish I had. I'm very hopeful, but things look bleak. I think with the winter coming, the next thing is going to be a lot of diarrhea because of rotavirus, because we are not giving the rotavirus vaccine. I think we're going to be doing that seasonal part of it, and then hopefully, not much of influenza, but influenza is coming. So I think we are and I don't know, Dr. Asna can probably answer how bad COVID is in Gaza or has been in the past, but we're getting into that season of a lot of respiratory infections, and with a lack of rotavirus vaccine, maybe rotavirus diarrhea, and in addition to everything else. I mean, this is not it's not going to replace anything. So I think it's unfortunate, but I think with the close proximity of everybody living in these tight quarters, these diseases are going to spread faster and quicker. The respiratory illnesses, RSV is probably going to come in. In the United States, we are seeing adenovirus. I think unless, as Dr. Hamouda said, unless the war stops, expect things to get worse. Last winter season was early, and so things were not as bad as they are now. So unless the war stops, and I'm a little encouraged, because within Israel, there people are asking for the war to end. So I think for whatever reason, I don't care how it ends, but as long as the war ends, that's important for us to take part in. So I think Dr. Hamouda, Dr. Asnak just reported that rotavirus vaccine is also being given right now. So that's good news because that's another one we can easily prevent. We don't see rotavirus in the United States anymore. And so thank you for that, Dr. Sega.
Thank you, everyone. Thank you to our guests, and we'll be getting the recording out today, so we'll certainly want that to circulate. Thank you for our guest speakers for joining us. Much appreciated. And I think with that, let's close or Dr. Hamouda, go ahead. You closing words, please.
Thank you for all our association that prepare the polio vaccination, UNICEF and WHO and the global. And thank you for Rebuilding Alliance for efforts. And I am sorry and apologize for late for today because the internet connection is very bad. Thank you very much.
I also want to thank, in addition to Rebuilding Alliance making this series possible, the International Association of Social Pediatrics and Child Health, ISOP, has been instrumental in making this happen. So just really a big thank you to the pediatrician community, the medical community, for your words carry so much throughout every society. And if anyone can move mountains, it's you. So thank you again. Thank you once again to our doctor from UNICEF. Take care, everyone. Let's close our webinar here.
Bye-bye.
Bye.
Thank you. Bye. Thank you.
Thank you. You're welcome to stay for a moment.